The Houston heat had already started climbing at 2 a.m., the kind of relentless Texas August that didn't care about the sun. Katie Morrison pushed through the employee entrance at Mercy General, her badge clipping to her scrub pocket with a soft metallic sound. The fluorescent lights hummed their familiar industrial song as she moved through the corridor, her sneakers making almost no sound against the tile. 12 hours ahead. Night shift. She'd been doing this for 8 months now, and the rhythm of it had become almost meditative, a way to disappear into work, to be useful without being seen. Her hands trembled slightly as she set her bag in her locker on the 3rd floor. She pressed both palms against the cool metal door and held them there for a count of 4. The tremor wasn't fear. Fear would have been manageable. This was something deeper, something that lived in her muscle memory and woke up without permission. She'd learned to hide it by keeping her hands in motion, always reaching for something, always adjusting something. Busy hands didn't shake. Or at least, nobody noticed when they did. The night shift at Mercy General ran lean. 3 nurses for the surgical ward, 1 attending physician on call, 2 residents if something critical rolled in. Katie had already memorized the rhythm of who worked when, who could be trusted to double-check a dosage, and who cut corners when they thought nobody was watching. 8 months of careful observation. 8 months of keeping her head down and her competence invisible. She moved through the nurses' station at 2:14 a.m., scanning the board for her assignment. For patients on post-op recovery, 1 fresh admission for observation, 1 scheduled for early morning CT routine. The kind of night where the biggest crisis would be a patient hitting their call button for ice chips. She was reviewing the medication charts when she noticed it, a faded unit patch on a waiting room chair visible through the glass wall. 75th Ranger Regiment. The colors had long since dulled, the stitching loose where it had been sewn into a jacket lining, but the insignia was unmistakable. She paused. 3 seconds. Breathed. Kept moving. Dr. Sterling arrived at 2:06 a.m., which was earlier than usual. She heard his footsteps before she saw him, the expensive shoes clicking against tile with a rhythm that suggested he owned the space rather than worked in it. He moved through the ward the way a shark moves through water, scanning for weakness. Dr. Marcus Sterling was 43 years old, had graduated top of his class from Johns Hopkins, and had never once questioned whether his position at the top of the hospital hierarchy was exactly where he belonged. His presence made the fluorescent light seem harsher somehow, casting sharper shadows. He stationed himself at the far end of the nurse's station, coffee in hand, reviewing something on a tablet with the expression of a man who already knew he wouldn't like what he found. His gaze swept across the 3 nurses on shift, 2 of them senior staff he'd worked with for years, and Katie, who he'd classified within her first week as competent but unremarkable. The type who did the work, kept quiet, and wouldn't make any waves. Exactly the type of subordinate who made his life easier. She had trembling hands and averted eyes and moved like someone apologizing for taking up space. He barely registered her as a threat to anything. Katie was working through the post-op charts when she caught it, a dosage error on the medication order for room for 12. Not a small one. Metformin prescribed at 2,500 milligrams when the patient's renal function couldn't handle more than 1,000 without risk of lactic acidosis. The kind of error that could land someone in the ICU. She pulled the chart, found the ordering resident's name, and made a note in the margin before walking over to Sterling's position at the station. Dosage issue, she said quietly, setting the chart down with 1 finger pointing to the line. Her voice was soft, carefully neutral. Room for 12. Metformin at 2,500. Patient's creatinine is 1.8. Sterling glanced at the chart. Actually glanced at it, the briefest possible acknowledgement before his eyes flickered back up to meet hers. There was something in that moment, a nanosecond where she saw recognition flicker across his face. Recognition that she was right. That she knew what she was talking about. That she'd caught something important. And then his jaw tightened almost imperceptibly. Which resident wrote this? His tone had shifted. Where before there had been indifference, now there was something else, something sharper. Something territorial. 3rd year. His first rotation. Katie's hands remained steady. She'd learned years ago how to keep her voice level when delivering corrections. How to present information without ownership. How to make it seem like she was simply informing, not advising. Just a heads up. He picked up the chart and studied it with deliberate slowness, his fingers tracing the order line. The fluorescent lights continued their mechanical hum. Somewhere on the second floor, a call button chimed, and one of the other nurses moved to answer it. Sterling set the chart down, but didn't move it away from him. Held it. "We have attending physicians to catch these things," he said finally. His eyes were still on the chart, not on Katie. "That's their job." "Yes, doctor." She'd already started to turn away, her role in this conversation finished. She had patients to check on. For lines to verify. Vital signs to monitor. For more hours until the day shift arrived and she could disappear back into whatever quiet corner she'd carved out in her life. But his next words stopped her. "In the future, route medication questions through the resident." "Not me." There was no malice in his tone, which somehow made it worse. It was the tone of someone correcting someone who should have already known better. Someone beneath consideration. That's the chain of command. Katie didn't respond. She simply nodded and walked toward room 408, where Mrs. Chen, no relation to the name she'd seen on that unit patch, needed her vitals recorded. Her hands remained steady as she checked the foresight, adjusted the infusion rate, and made her notes. But she felt Sterling's eyes on her back, and she understood something in that moment with absolute clarity. He had seen her competence, and it had made him uncomfortable. Not impressed. Not validated. Uncomfortable. Because competence in someone he'd already dismissed as unremarkable threatened something about the way he needed the hierarchy to work. She wasn't supposed to catch critical errors. She was supposed to follow orders. She was supposed to be the type of subordinate who made his life easier by being exactly what she appeared to be, a quiet night shift nurse with trembling hands and a tendency to avoid eye contact. She was not supposed to be right. And that, she could already tell, was going to become a problem. The rest of her shift unfolded with the quiet precision of someone who'd spent years operating under pressure. She moved through room 412 and verified the medication order had been corrected without her name attached to the correction. The error had simply been caught and fixed, the way it should be. She repositioned patients who showed early signs of pressure ulcers, adjusted full lines that had drifted, and documented everything with the exact specificity required. 8 months of careful practice meant she could move through a patient room, assess a situation, and respond to it without drawing attention. The kind of attention she didn't want. At 4:13 a.m., she was reviewing discharge paperwork when an admission came through. John Doe, brought in by ambulance, no identification on him. Trauma history, significant scarring, confused and combative on arrival. He'd be taken to observation, probably transferred to another facility in the morning. She watched from a distance as he was wheeled past her station, his jacket removed and tossed onto a chair by the receiving nurse. The sleeve caught her eye. The way the lining had been reinforced. The careful stitching along the seams. And then she saw it, the faded patch sewn into the inside. 75th Ranger Regiment. Same unit. Same distinctive stitching pattern. 2 patches within hours of each other. She didn't approach the chair. Didn't acknowledge it. Simply filed the observation away in the part of her mind that had been trained for years to notice patterns, to read situations, to understand what was actually happening beneath the surface of what appeared to be happening. Dr. Sterling was standing at the nurse's station when she finished her documentation at 5:08 a.m., 13 minutes before shift change. He was reviewing something on his phone, his presence somehow making the station feel smaller. She gathered her papers, checked that everything was documented correctly, and prepared to hand off to the day shift nurse who was already arriving. But as she passed him, he spoke without looking up from his phone. "Good catch on room 412. Even if you did handle it incorrectly." It wasn't praise. It was a reassertion of hierarchy. A reminder of exactly where the pecking order stood. She paused, one beat, and then continued walking. She didn't need to respond. She'd learned long ago that sometimes the most powerful thing a person could do was say nothing at all. The nurse's station at 2:17 a.m. was quiet except for the soft percussion of keyboards and the distant hum of the ventilator in room for 12. Katie had her head down, charting the vitals from the patient she'd just cleaned up after a post-op recovery, stable, breathing easy. She was focused. She was safe in her own competence. That was always when Sterling arrived. He came with his 3 residents trailing behind him like remoras on a shark, their white coats still pristine despite the hour, their eyes still sharp with the hunger of surgeons who'd never yet failed at anything that mattered. Sterling's voice carried the particular timbre of someone accustomed to rooms going quiet when he spoke. "I give her a week," he said. Not to anyone in particular. Just said it, the way a man might comment on the weather if the weather had started working at his hospital and had the audacity to correct him. He pulled his wallet from his pocket with a flourish that made the gesture theatrical. $50 says our little floor nurse can't handle real medicine. He placed 2 20s and a 10 on the counter, the bills arranged with deliberate precision. Anyone? The residents laughed. Not genuine laughter, the kind of laughter that exists only when power is present to authorize it. One of them, a thin man with a German accent and the particular cruelty of someone still proving himself, actually slapped the counter. The sound was sharp. Deliberate. Katie's pen stopped moving. The tip hovered 1/8 of an inch above the chart. Her eyes didn't lift from the medication reconciliation form in front of her. She counted 5 heartbeats. Then she let the tear come. It was a tactical decision, something her body understood even if her conscious mind was still catching up. She let one tear slip from her left eye, just one, let it travel the length of her cheekbone. Then she set her pen down with careful precision, found the edge of her scrub sleeve, and wiped the tear away without breaking eye contact with the chart. When she looked up, her eyes met Sterling's and held. "When you're done performing for your audience," Katie said, her voice pitched low enough that only the people within 6 feet could hear, "that patient in 304 still needs the correct antibiotic dosage." She paused. The silence was the kind that exists in the space between heartbeats. You prescribed cefotaxime to a patient with a documented type 1 penicillin allergy. The cross-reactivity rate is 1.5%, but this patient's chart clearly states anaphylaxis to penicillins at age 8. Do you want to rewrite that order, or should I call pharmacy to flag it? Sterling's face did something interesting. It went through a progression, first the flush of anger, then something else. Something like the expression of a man who'd expected a particular sound from a door and heard something else entirely. The residents' laughter died. One of them actually looked at his shoes. Sterling snatched his bills from the counter. He didn't say anything. He simply turned and walked away, his residents scrambling to follow, and Katie went back to her charting. Her hands didn't shake. Her breathing remained even. The only thing that betrayed her was the way her pen moved slightly faster than before, the medical notation becoming almost aggressive in its precision. 3 days passed. 3 shifts. 3 instances of Sterling calling her into rooms and then standing too close, or finding fault with her for placements that were textbook perfect, or sighing audibly whenever she entered the surgical suite. Katie absorbed it like soil absorbs rain, silently, without complaint, without visible response. She simply worked. She simply corrected what needed correcting and moved forward. The cafeteria on the 3rd day was crowded with the lunch shift, the morning people and the graveyard holdovers mixing in that awkward space between breakfast and lunch. Katie carried her tray past the table where Sterling sat with 3 of his residents. The tray held the specific diet she'd prepared: grilled chicken, steamed broccoli, a small container of brown rice. Fuel. Nothing more. Sterling's elbow moved as she passed. Not a twitch. Not an accidental gesture. A movement with the kind of precision that only comes from intention. His arm struck her tray at the exact angle needed to maximize dispersal. The tray spun out of her hands. The plate hit the floor with the sharp crack of ceramic breaking. The container of rice scattered across the tile in a pattern like tiny accusations. The broccoli rolled in different directions, seeking corners, seeking escape. The laughter started immediately. Not shocked laughter. Prepared laughter. They'd been waiting for this. Katie stood very still. She looked at the debris of her lunch scattered across the cafeteria floor, watched the broccoli still rolling, watched Sterling settle back into his chair with the expression of a man who'd just successfully proven a point. Then she kneeled. She moved with methodical precision, gathering each piece. The fork first. The spoon. The broken plate fragments, carefully, so they wouldn't cut her. The rice she gathered by hand, grain by grain, sweeping the floor with her fingertips in that particular way that suggests no anger, no hurry, no feeling at all. She stood. She walked to the trash receptacle, and she disposed of every item. Then she filled a fresh tray, the exact same lunch, and sat alone at a corner table facing the wall. Her hands didn't shake. Her jaw was locked, but only because locked jaws don't tremble. 1 week later. A Tuesday. The corridor outside the ER was empty except for Katie and Sterling and the patient chart that Sterling held like a weapon. "Pick that up, sweetheart," Sterling said, and he threw the chart at her feet with the particular violence reserved for objects that can't bleed. "Maybe if you spent less time playing doctor and more time doing your actual job, you'd know how to file properly." Katie bent. She retrieved the chart. She opened it while still crouched, her eye scanning the medication list with the speed of someone who'd read 1,000 charts in 1,000 crisis moments. Her hands, scarred from a decade of things that happened in places that nobody was supposed to know about, turned the pages with methodical care. She stood. "This patient," Katie said, "is allergic to penicillin. You prescribed amoxicillin. Should I file this with the Patient Safety Board or would you like to rewrite it?" Sterling's hand shot out and snatched the chart from hers. His face had gone the particular shade of red that comes from the realization that his power wasn't working, that something he'd done with absolute confidence had failed to produce the expected result. "She won't last the month," he muttered to the resident beside him, but his voice had lost its certainty. It had become the voice of a man talking to reassure himself. Katie walked away. She didn't run. She didn't retreat. She simply turned and moved toward the next patient, the next crisis, the next place where her competence was needed. Behind her, Sterling stood in the corridor holding a chart with a medication error that would now have to be corrected, explaining to his resident why a floor nurse had just humiliated him in front of witnesses. But that wasn't the worst part. At 3:17 a.m., the ER doors burst open and a paramedic team wheeled in a stretcher carrying a John Doe. Male. Approximately mid-40s. Found unconscious near the Houston VA hospital parking lot, according to the intake sheet. No wallet. No phone. No identification of any kind. The paramedics had done their work, oxygen already running, a peripheral for in place, vital signs being called out in that rapid-fire cadence that means something serious is happening. Katie was assigned intake. She was the one who cut away the torn jacket, the one whose hands moved across his chest cataloging injuries. The bleeding had slowed. He was breathing, which was more than could be said for a lot of people who arrived the way this man had arrived. That was when she saw it. Sewn into the interior lining of the jacket, nearly invisible unless you were looking for it, was a patch. Faded. Worn. The insignia of the 75th Ranger Regiment, that particular combination of colors that meant something very specific to someone who'd spent 12 years understanding what it meant. Her hands froze for exactly 2 seconds. Then she resumed cutting, her mask of professionalism snapping into place like a submarine door sealing shut. She rolled up his sleeve to start the fall line and saw the tattoo on his inner forearm. Black ink. Block letters. Phoenix. And below it, coordinates that meant nothing to anyone else in the room, but meant everything to the person who'd heard that call sign screamed across a radio transmission in Marja, Afghanistan, on a night when everything had gone wrong and stayed wrong for 37 minutes straight. Her vision tunneled. The room became very far away. She pulled oxygen into her lungs in a way that felt deliberate, like something she had to remember how to do. The patient's scarred face was difficult to read because trauma does that, it rearranges everything. But there was a pattern of shrapnel damage along his left temple that she recognized. A signature wound. The kind of injury that comes from a specific type of IED in a specific type of convoy moment, and she'd held the person who had that wound in her arms while they bled onto her uniform, and she'd thought they were gone, thought they'd died right there, thought she'd have to write one more letter to one more family that she'd never meet. She checked his pupils. Unequal. The left one was sluggish. Intracranial pressure. She knew that symptom profile like she knew her own reflection. He needs a CT scan, she said to Sterling, who had wandered into the trauma bay with the particular disinterest of someone who'd already determined the patient wasn't worth his time. Possible intracranial pressure. Traumatic brain injury pattern. Sterling didn't look up from his tablet. County can scan him. We're not a charity ward. Katie's jaw tightened. She began the scan request anyway, her hands moving across the computer keyboard with the same methodical precision she'd used picking up scattered rice off the cafeteria floor. The request went through. The order was in the system. The imaging suite would receive notification that they had an incoming patient requiring emergency CT. Sterling noticed. He crossed the room in 3 strides, and Katie watched him cancel the order on the computer with 2 keystrokes. The denial was immediate. Cold. Final. Did I stutter, sweetheart? The patient's monitor began alarming. Heart rate. Dropping. 142 to 128 to 112 to 88 in the space of 8 seconds. Katie's combat instinct surged through her body like a door opening. She could feel the shift happening, the part of her that had been dormant, carefully buried under 8 months of civilian performance, suddenly coming alive. The patient went into cardiac arrest. The ER doors burst open at 3:13 a.m. Rain hammered the ambulance bay outside, and with it came a stretcher carrying a man who looked like he'd been pulled from a grave. Male, approximately 40, unconscious, clothes torn and mud-caked, no wallet, no phone, no identification. The paramedic called out vitals as they moved, BP 118/72, O2 sat 94 on room air, GCS 8, found unresponsive near the VA parking lot. A John Doe. Another nameless body on another night shift in Houston. Katie was pulling sutures from a laceration 3 bays down when the crash team moved past her, Sterling already barking orders before the patient was fully transferred to the bed. She glanced up from her work, just for a second, and that was when her hands went still. Not trembling. Still. The kind of stillness that comes from muscle memory recognizing something the conscious mind hasn't caught up to yet. The jacket. Faded denim, torn at the seams, smelling of diesel fuel and old blood. But there, sewn into the lining where only a soldier would stitch it, the patch. The faded 75th Ranger Regiment unit insignia. Her unit. The one she hadn't seen in 12 years. Katie finished suturing, tied off the thread with one clean motion, and told her patient to keep the wound dry. Then she moved. Not fast. Not urgent. Just moved, the way trained personnel move when they've decided to be in a particular place. The triage nurse was prepping 4 lines, and Sterling was already demanding a head CT, spinal precautions, the full workup. Nobody noticed Katie slip in at the foot of the bed. She didn't look at the face first. She looked at the arms. Scarred. Deeply scarred, the kind of scars that come from shrapnel, from blast radius burns, from spending time in places where the ground itself tried to kill you. Then she traced her eyes upward, past the medical tape and monitor leads, to the tattoo on his left bicep. Phoenix. Her call sign. Inked in black letters, faded now, the edges blurred like the memory of a life lived long ago. But unmistakable. Absolutely unmistakable. Her eyes finally moved to the face. The face was wrong. It was right and wrong simultaneously. The bone structure was there, the same high cheekbones, the same sharp jaw that she remembered from a hospital tent in Marja where he'd been screaming from the pain of a TBI that had shattered the left side of his skull. But the eyes that opened slightly, reflexively, were blank. Unrecognizing. The face of someone whose brain had been rewired by trauma into something new. Something unfamiliar. Private James Chen. The soldier she'd carried 8 miles through Helmand Province gunfire. The one who'd been unconscious for 4 weeks, then semi-conscious for 2 more, his traumatic brain injury so severe that when he finally woke up fully, the docs at Walter Reed said he'd lost everything from the past 6 years. The explosion that saved him by knocking him unconscious had stolen everything else. His memory. His sense of self. His face, in his own mind. Katie stood at the foot of the bed and felt the mask she'd constructed over 8 months crack in a way she wasn't prepared for. Katie. Sterling's voice cut through the moment like a blade. She'd been standing too long. Noticing too much. We need continuous cardiac monitoring, and he didn't finish. He was already turning to his residents, dismissing the John Doe as a low priority, just another trauma consult from the VA population. Nobody important. Nobody worth his time. Post-intoxication presentation probably. Get tox screen, standard panels, and move him to monitored bed in trauma 2. No indication for CT at this hour. Katie's jaw clenched. Not from fear. From the specific kind of restraint that comes from knowing you cannot speak without your voice revealing everything you've buried. She turned away from the bed, moved back to her station, and pulled up the patient's file on her monitor. John Doe. Age estimated 42. No identification. Found near VA hospital by transit police at 2:38 a.m. She pulled up the admission photo, the one taken when he arrived, and stared at it. At the patch visible in that photo, right there in the jacket lining. At the tattoo visible on his arm in that image. At the face that was exactly, unmistakably, impossibly the face of the soldier she'd spent 12 years trying to stop thinking about. The pericardial fluid pooled in his jacket. That's why he was here. That's why the vest had been torn, shrapnel, probably, old injury reopened. Cardiac tamponade wasn't something you survived by accident. Katie's hands, when she looked at them, were steady as surgical steel. They had to be. Because if they started to tremble, if she let the shock show, if she broke the carefully constructed performance of being just another competent nurse, then Sterling would notice. And Sterling noticed everything when it came to her. She kept her hands on the keyboard and did what she'd been trained to do in 1,000 impossible moments. She filed the shock away. Locked it down. Made space for the only thing that mattered. The patient was going into cardiac tamponade. His condition was declining under Sterling's dismissal. And in approximately 90 seconds, his heart was going to fail. Katie stood up from her station and moved toward the supply cart without asking permission. Her movements were precise, economical, the movements of someone who had done this exact thing in conditions far worse than a well-lit Houston ER. Sterling's voice came from across the room, sharp as breaking glass. "Morrison, what are you doing?" "Preparing for code," Katie said quietly. Her voice had dropped an octave. The deferential pitch she'd maintained for 8 months had evaporated like water from hot pavement. "I didn't order a code. Get back to triage." But the monitor was already starting to show the signs. Muffled heart sounds through the stethoscope, she could hear them from here, that distinctive quiet that meant fluid was surrounding the heart, compressing it, slowly suffocating it. Distended jugular veins. The BP beginning its descent. And James Chen, unconscious, heading toward the last 3 minutes of his life while Dr. Sterling wrote notes and made decisions based on dismissal and ego. Katie pulled the pericardiocentesis kit without authorization. The 14-gauge needle was cold in her fingers. She'd done this before. Not in an ER. In a field hospital in Marja, with nothing but a handheld ultrasound and the knowledge that if she didn't aspirate the fluid from around the heart in the next 4 minutes, the soldier in front of her was going to die on that canvas cot. She'd saved him then. She could do it again. Touch that kit. Sterling's voice came from directly behind her now, and it carried the kind of calm that came right before violence, and you are suspended. Out of this hospital within the hour. Pending investigation for insubordination and unauthorized procedures. I'm running this code. Prepare for intubation. Katie held the kit. The rain outside hammered against the ER windows like applause from a crowd that couldn't be seen. The monitors beeped their steady rhythm around the room. Sterling's residents froze, watching the power dynamic shift in real time, watching a nurse openly defy a doctor without flinching, without apologizing, without the appropriate gender-coded deference that should have made her back down. The monitor flatlined. It was a sound Katie had heard exactly 3 times in field hospitals, and both times it meant she had approximately 90 seconds to make a choice between her career and a human life. Sterling's hands, which had been moving through the motions of ACLS protocol, stopped. His face went pale. His residents looked at each other in the kind of panic that comes from watching your attending physician completely lose comprehension of how to move forward. The moment stretched. 3 seconds. 4. The kind of silence where you can hear your own heartbeat and the rain and the distant hum of fluorescent lights above. Katie stepped forward. She didn't ask. She didn't explain. She opened the kit, prepped the insertion site over the xiphoid process with an alcohol swab in 3 seconds flat, and felt for the angle that would take her through the pericardial membrane without puncturing the heart itself. 12 times in marja. 12 times under fire, in heat, with inadequate supplies and the absolute knowledge that if her hand moved a millimeter wrong, the patient died. She'd never had a failure. The needle went in with that specific pressure sensation, a pop through membrane, then give, then resistance as the heart itself pressed against the catheter. Sterling's voice came from somewhere outside her focus, distant and ineffectual. Stop. That's an order. Katie aspirated. The syringe filled with blood, 60 cubic centimeters of it, the exact amount of fluid that had been crushing Chen's heart, stealing his life by increments. She pulled the fluid out with the steady precision of someone who had been trained by the U.S. Navy to keep people alive in conditions where everything was actively trying to kill them. The monitor spikes. Rhythm returns. A normal sinus beat, clean and strong and alive. The patient gasps. Chen gasps, reflex breath, the sound of a man coming back from the edge of nothing. Katie secures the catheter with practiced efficiency, tape, connection to drainage bag, placement of the catheter with the precision of someone who had done this 1,000 times in training and never once questioned whether her hands could be trusted to do the work. The room goes completely silent except for the steady beep of the heart monitor. Normal rate. Normal rhythm. Oxygen saturation climbing, 89%, 92%, 95%. Patient stabilized. Patient alive. Katie's hands are rock steady as she secures the final piece of tape. She can feel Sterling's eyes on her, hot and calculating and full of something that looks like fear. She looks at him across the bed with the expression of someone who has just saved a life in front of witnesses and knows exactly what that means for the power structure of this hospital. Patient stabilized, she says quietly. Sterling's face is ash-gray. The residents are staring at her like she's become something they don't have a name for. The patient, Chen, though Sterling doesn't know this yet, is breathing steadily, alive, his heart no longer being crushed by its own blood. Sterling's jaw moves. He swallows. His eyes move from Katie to the monitor to his residents and back again, calculating, recalculating, understanding with absolute clarity that a nurse just overrode his direct order and saved a patient's life in front of at least 8 witnesses. He steps back from the bed. His hands are trembling, though he hides them by crossing his arms over his chest. When he speaks, his voice is very quiet. Everyone out. Except you, Morrison. We need to talk about your insubordination. The crash cart wheeled through the ICU doors like thunder rolling through a canyon. Katie heard the monitor first, a screaming pitch that meant one thing. Cardiac tamponade. Muffled heart sounds. Distended jugular veins. Blood filling the pericardium. Chen's blood pressure dropping like a stone, 88/52. then 82/48. The room flooded with bodies. Dr. Sterling barked orders like he was reading from a protocol manual he'd memorized but never lived. Get 2 large ball lines. Push epi. Get cardiology on the phone. His voice had that thin quality it always did when he wasn't certain, a man reciting lines he hoped would land. Katie stood at the monitor, watching the waveform collapse in real time. The rhythm was still organized. Still salvageable. But not for long. O2 sat dropping, 89. 84, 79. The ventilator wheezed its mechanical rhythm, fighting against physics it couldn't win. Nurses scrambled to hang blood products. A resident fumbled with a second full line. Sterling moved to Chen's bedside, his hands hovering over the patient's chest as if proximity to action could substitute for knowing what to do. His jaw was tight. His eyes were scanning. Not assessing. Searching. Like a man reading a restaurant menu in a language he didn't speak, trying not to look like he didn't know what to order. Katie's hands were already moving before her conscious mind caught up. She crossed the room in 4 strides, not running, never running, but moving with the terrifying fluid precision of someone who'd done this before and couldn't afford to hesitate. The crash cart was beside Chen's bed. She opened the drawer without asking permission. Sterile gloves. Alcohol prep. The 18-gauge needle for pericardiocentesis. Her fingers found them like a piano player finding home keys in the dark. Muscle memory took over. Her hands didn't shake. Her breathing didn't change. The trembling wasn't fear. It was restraint against the flood of every combat memory that came with knowing a life hung on the next 60 seconds. "What are you doing?" Sterling's voice cracked like a whip. "Step back. That's beyond your scope." Katie didn't answer. She didn't have time for words. She prepped Chen's chest with the alcohol, felt the cold fluid evaporate against her fingertips. 5th intercostal space. Midclavicular line. She palpated the landmarks with her left hand while her right held the needle steady. The ultrasound was already on her hip, she'd grabbed it before anyone else remembered it existed. Bedside ultrasound showed the fluid collection. 3 centimeters of pericardial effusion pressing on the heart. Suffocating it. Killing it slowly while every second counted down like a bomb timer. Code Blue protocol doesn't authorize nurse-led procedures, Sterling said, his voice rising. Someone remove her from the field. But nobody moved. They were all watching. The resident with the failed full line. The cardiac nurse. The respiratory therapist. The surgical attending who'd stepped into the doorway. Everyone was watching Katie Morrison, night shift nurse, the woman Sterling had thrown a patient chart at like she was nothing, as her hands moved with the kind of certainty that belongs to people who've held other people's lives in their palms while bullets cracked overhead. She found the angle. Steady. Her needle went through skin like it was made of paper. The pericardium was next. Through the fibrous layer. She felt the give, that small surrender of tissue when you've got the geometry exactly right. Then the hiss of air escaping as the syringe filled with blood. Dark blood. Clotted blood. Blood that had been pressing Chen's heart into a corner of his chest, squeezing it into submission. O2 sat climbing, 84. 87, 91. The blood pressure monitor beeped once. Then again. 94/58. Then 98/62. The waveform on the monitor steadied. The rhythm became regular. Sinus rhythm. Normal. Ordinary. Alive. Katie withdrew the needle and applied a pressure dressing without being told. Her hands were steady as surgical lasers. Her voice when she spoke was flat, clinical, a nurse reporting findings to the team, approximately 250 milliliters of hemopericardium evacuated. Patient responding. Monitor shows normal sinus rhythm. Blood pressure stabilizing. Recommend formal cardiology evaluation and imaging to identify source of bleeding. The room exhaled. Not in relief. In shock, Dr. Sterling stood frozen at the foot of the bed, his hand still raised in that hovering gesture, suspended in the moment between before and after. His face had gone the color of old bone. His eyes moved from the monitor to Katie to Chen's rising and falling chest. She could watch the calculation happening behind his eyes. Not gratitude. Never gratitude. Something colder and more dangerous. The understanding that he'd just been unmade in front of every single witness in the room. That a night shift nurse, a woman he'd dismissed as beneath him, a woman he'd publicly bet would quit within a week, had performed a critical procedure with the kind of textbook precision that came from having done it for real, under conditions that would make most surgeons weep. His thin smile had evaporated. In its place was something tight and predatory. "We need to talk about your insubordination," he said quietly. Katie was already removing her gloves. She met his eyes once, just for a second. Long enough for him to see there was nothing in them. No fear. No apology. No uncertainty. She disposed of the gloves in the biohazard container and turned back to the monitor, already checking trend lines, already moving to the next task, already acting like the man standing behind her didn't exist. "Patient is stable," she said to no one and everyone. "I'm going on break." But Sterling wasn't finished. He was already reaching for his phone, his jaw working like he was grinding glass, his eyes tracking Katie as she left the room. Within 2 hours, by the time the sun was threatening to break over Houston's eastern horizon, Katie would be pulled from her shift and escorted to an administrator's office. Within 4 hours, formal complaints would be filed, performing a procedure beyond nursing scope of practice. Insubordination during a medical code. Unauthorized use of surgical equipment. Within 6 hours, Sterling would have called 2 board members, men he played golf with, men who owed him favors from a dozen networking dinners. Within 8 hours, an external patient safety investigator would be assigned to review every single patient interaction Katie had documented in the past 8 months. But that wasn't the worst part. What happened next didn't just silence the room. It changed everything. By 4 p.m., the suspension letter was in Katie's hands. By 5 p.m., she was walking out of Mercy General's main entrance with a box containing 8 months of her life, scrubs folded with precision, a pen with the hospital's logo, a coffee mug someone had given her for surviving the first month. Sterling had personally walked her out, his thin smile finally restored, standing near the security desk with his arms crossed, watching as she moved past him like she was already a ghost. The locker room had been empty. Katie's hands had stayed steady while she cleaned out her space. But in her car, sitting in the parking lot as rain began to hammer the windshield like applause for a show nobody wanted to see, something cracked. Her hands started to shake. Not with rage. With exhaustion. With the weight of 12 years of silence finally pressing down with its full gravity. She'd run from the military because the PTSD had become a living thing, something that woke her at 3 a.m. and told her she'd made all the wrong choices. She'd chosen anonymity to heal. She'd chosen to disappear into the quiet work of nursing, imagining that saving strangers would somehow balance the scales of a past she couldn't fix. She'd been wrong. By 7 p.m., Katie was walking through the doors of the Houston VA hospital. Not as a provider. As a patient. She moved through the waiting room like a ghost moving through familiar places, men and women in various stages of broken, some with visible injuries, some with the 1,000-yard stare that meant the injury was internal and never quite healed. She'd treated these people once, in another life. She'd held their hands. She'd learned their names. She'd fought for them. Now she was asking them to fight for her. The intake form asked for military service history. Katie stared at the blank space where her name should go, her pen hovering like a bird deciding whether to land. Senior Chief Petty Officer. 12 years. 3 combat tours. Decoration she'd never framed and decoration she'd never mentioned. She couldn't write it. The words wouldn't come. A young Marine 2 seats over, couldn't have been more than 25, with the kind of haunted look that meant Kandahar or Fallujah or somewhere worse, recognized something in her face. He nodded. Not a greeting. An acknowledgement. She nodded back. Then she crumpled the form, stood, and left. In her car, 40 minutes later, Katie Morrison finally cried. Rain hammered the glass. Her hands shook against the steering wheel. She cried for the soldier she'd carried through Marja. She cried for the nurse who'd saved strangers and abandoned the people who needed her most. She cried for the identity she'd buried so deep she'd almost believed it was dead. Her phone rang. The caller ID read, Mercy General Hospital. Katie stared at the number for 3 rings before she answered. Ms. Morrison. A woman's voice. Clinical. Official. This is the ICU desk. Your patient, the John Doe from this morning, he's regained consciousness. He's asking for the nurse who saved him. The board chairman has authorized your immediate return to the hospital. He's calling you personally with clearance. Katie, he won't proceed with any further treatment until you're present. Katie didn't answer right away. Through the rain-streaked windshield, she could see the lights of the VA hospital. Could see the broken people moving through its corridors. Could see the reflection of a woman who'd spent 8 months running from herself. I'll be there in 20 minutes, she said. The rain stopped exactly halfway to Mercy General, as if the city itself was holding its breath for what came next. The rain had stopped halfway to Mercy General, and Katie made it back to the hospital in 19 minutes, her hand still moving with the precision of someone who'd performed that procedure in combat conditions. She'd saved a life. She'd done it in front of witnesses. She'd done it in front of Dr. Sterling. But by 6:16 p.m., while Katie was still documenting the pericardiocentesis in Chen's chart, Sterling was in his office making phone calls. The first call went to Dr. Marcus Hayes, a board member with a country club membership and a wife who'd benefited from Sterling's referrals for the past 8 years. Sterling's voice was calm, measured, the voice of a man protecting institutional order. Marcus, we have a situation. One of our nurses performed a procedure outside her scope of practice today. Cardiac intervention. No physician present. I need documentation that this was a protocol violation. The pause on the other end lasted 3 seconds. Then, I'll make some calls. Sterling hung up before Hayes could ask questions. The second call went to the hospital's chief of staff. The third went to a private investigator Sterling had used before, a man named Dennison who specialized in background checks and reference verification. I need everything, Sterling said. Employment history, prior incidents, any gaps in her background. 8 months of work. There's got to be something. People don't go from nothing to nursing without a trail. Within 2 hours, the machinery was moving. Sterling had activated a network built on 8 years of professional favors, institutional leverage, and the quiet understanding that authority protects its own. Board members began receiving calls. Hayes called 2 other members. One of them called the hospital administrator. By 10 p.m., an external investigator named Patricia Chen, no relation to the patient, had been brought in to conduct a formal review of Katie's patient interactions over the past 8 months. The investigation wasn't looking for competence. It was looking for violations. The investigator arrived at 5:22 a.m. the next morning with a laptop and a list of patient files. She began reviewing charts methodically, hour by hour, looking for deviations from protocol, documentation gaps, any moment where Katie had stepped outside the defined boundaries of nursing practice. She found nothing. Chart after chart showed meticulous documentation, flagged medication errors, corrected dosages, and patient outcomes that were statistically superior to unit averages. But that wasn't the point anymore. The investigation wasn't about Katie's competence. It was about building a case. At 6:02 a.m., hospital security arrived at Katie's locker with a manila envelope. Katie was finishing her shift notes, her scrubs still bearing the faint copper smell of an emergency thoracotomy. Ms. Morrison, you need to come with us, the security officer said. His name was Reynolds, a man Katie had worked with for 8 months without incident. He wouldn't make eye contact. The walk to the administrator's office took 4 minutes. Katie didn't ask questions. She'd been trained for extraction scenarios. This was just a different kind of terrain. Through the hospital corridors, past the cafeteria where Sterling sometimes threw his weight around, past the nursing station where her colleagues watched her pass like they were watching someone disappear. In the office, the administrator, a woman named Reeves with a carefully constructed neutral expression, handed Katie a suspension letter on embossed hospital letterhead. Effective immediately, you are suspended pending investigation into protocol violations and scope of practice concerns regarding your treatment of patient James Chen on March 14th. You are not to enter hospital premises or contact hospital staff. You'll be contacted within 5 business days regarding the outcome of this investigation. Katie read the letter in silence. The words were careful, professional, legal. They said nothing about saving a life. They said nothing about the patient who would be dead if she hadn't acted. They said nothing about the fact that Dr. Sterling had frozen while a man's heart filled with blood. That was when she looked up and saw him. Sterling was visible through the office window, standing in the corridor with his arms crossed, watching. When their eyes met, he smiled. It was a thin smile, a smile like a wolf showing its teeth before the kill. His expression said, I own this place. You don't. And everyone now knows it. Security escorted Katie to the exit. Not the main entrance where staff would see her. A side door near the loading dock, where the delivery trucks came in. The early morning air hit her face like a slap. She was still wearing her scrubs. She was still wearing her badge. Katie drove to the Houston VA hospital that evening. Not to visit. To be seen as a patient. The waiting room was full of men and women in different states of disrepair. A veteran missing both legs was checking in. Another was accompanied by a service dog. A third sat alone, rocking slightly, his hand pressed against his temple. Katie recognized 2 of them from Mercy General, men she'd treated during night shifts, men she'd helped, men who wouldn't know her name but whose broken bodies she'd held together with steady hands and protocol. She filled out an intake form. Name, date of birth, insurance information. And then came the blank that mocked her, military service. Years of service. Rank. Branch. Katie's hands trembled as she held the pen. Not from fear. From the weight of 12 years pressing down on her shoulders, from the choice she'd made to disappear, from the fact that she'd tried to bury that part of herself and it was still alive, still demanding to be acknowledged. She could write it. Could fill in the blank. Could stop hiding. Instead, she left it blank. The intake clerk barely glanced at her. First time at the VA. Katie nodded. We'll get you set up with a psychiatrist. PTSD screening, trauma assessment. You'll be our first appointment tomorrow at 8 a.m. The clerk's name tag read Morris. He was maybe 40, with a kind of calm that comes from having sat across from 1,000 people who'd seen things that broke them. Katie drove home and sat in her apartment with the lights off. The silence was absolute, the kind of silence that had weight, that pressed against the eardrums like water pressure. She thought about Chen. She thought about Sterling watching her walk out of the hospital like he'd won something. She thought about the intake form sitting on the passenger seat, that blank space for military service growing larger in her mind with every passing second. The truth was simpler and more devastating than she'd allowed herself to admit. Disappearing hadn't healed her. It had just been another way of dying. Slower. Quieter. No less final. She'd spent 12 years running from a uniform and a rank that meant she was supposed to be strong enough to carry other people's weight. She'd spent 12 years telling herself that anonymity was survival. She'd spent 12 years watching broken veterans walk through Mercy General's doors and treating them like strangers because acknowledging what she was, what she'd been, would crack the careful foundation of her invisibility. And then James Chen had walked in, wearing her call sign on his arm like a prayer, and the foundation had shattered anyway. Subscribe to this channel for more stories of hidden strength and quiet heroes. Like this video if you believe that the most dangerous people are often the ones who choose to help rather than harm. And comment below, have you ever been underestimated by someone who didn't know your true value? Katie Morrison's story isn't finished yet. The truth is about to change everything.